I seem to notice a lot better development on this right side of my face. It looks more appealing to the eye. It seems as though my jawline is much stronger. It seems that there's a better contour to the other side of my face.
Do you have the TMJ pain on that side? Or is it both sides or what?
It's both sides, and it's hard to say now because it's been so long since I've had the crazy symptoms of it. Right now, I just sort of experience that general clogged and nasty feeling in the ears. I don't feel like I can hear anybody properly. And I think that that's noticeable here in this front-facing photo.
Okay, see, that straightens your nose right out.
Oh, interesting. Okay.
Yeah. So, I mean, dude, so maybe you're body dysmorphic and maybe you're hyper focused on the way you look, but your TMJ is not in your head. Your symptoms are not in your head. The root cause of this is your maxilla. Unfortunately, there's no good way to fix that apart from jaw surgery. Until you do that, as the TMJ resorbs, symptoms are going to get worse. That side is going to get shorter and shorter. You're going to get more and more retrognathic. I really feel strongly about you going to see Dr. Yousefian to get a diagnosis.
Okay.
I don't take conditions like yours lightly. If in fact your left TMJ is going through a state of resorption right now, I don't trust many other people in the country to look at that and diagnose it. Certainly not anyone in the Midwest.
I have to say, out of everything that I expected from the conversation this far, surgery was not one of them at all. I thought I was going clinically insane trying to figure out what's wrong with me. But to have somebody else in actual agreements with the data that I present itself and what you can see just from looking at me, the amount of relief is just like, I mean, you have no idea. You have no idea. It's nice to meet you, man. My name is Robby. I'm 23. I live in Cleveland, Ohio. And just for some context, I've been a mouth breather since I was a kid, as far as I can remember. I would say before prepubescent stage, I started to mouth breathe. Not exactly sure why, I don't recall. But in addition to that, poor neck and head posture have been horrible all the way since early adolescence. And in general, my posture has always been poor until probably late adolescence, sometime around 16, 17, I started to improve my, holding my shoulders back and standing up straight and such. And in my free time, I bodybuild and I'm pursuing a career in finance. Not really relevant at all, but figured I'd share.
Very relevant. Thank you for sharing that.
I suppose it could be. Some dental and orthodontic history. I had a Herbst appliance applied for several months in my early teens. I want to say 13 or 14. And that was to correct my overbite, and it brought essentially my jaw forward. I'm sure you're familiar with this device, but it was horrible. It sucked, but I think it did help with the issue of my mandible being much farther back than my maxilla, or at least correcting for the bite. I'm not sure what deleterious effects that caused down the line, downstream, but I don't know. Hopefully you have some insight on that in a little bit.
Sure.
After that, I had some Invisalign braces applied. I never had regular on-teeth braces, only the Invisalign. And it did its job. I simply just had some space here between the two front teeth, and I don't recall space intermolarly, but it did correct at least the aesthetic of my front bite as it presented.
Okay.
I got a retainer after that, which I wore pretty regularly for a few years, and I haven't worn that for about a year now. I can't really say why exactly. I've heard some different information here and there about retainers, and if you've had them in the past, perhaps stop wearing them. A lot of anecdotal stuff that just made me stop wearing it. I haven't noticed any poor effects from not wearing it, but I have stopped wearing it for about a year.
Okay.
I have all my adult teeth. I did not have my wisdom teeth removed, no premolar extractions, nothing like that. And recently I did measure my intermolar width, and it was 44 millimeters, or 1 3/4 inches. And I did the classic Dr. Mew test with the apple, sliced that in half and then bit it and measured the space between. So I'm not sure. I don't know if there's any variance in the accuracy of that, but it doesn't sound like there could be. And then in July, I had a septoplasty and a turbinoplasty. I'll get into that more with the symptoms here to follow, but that was relatively recently. So I'm not sure what downstream effects from that procedure I'm still experiencing right now, but it was a couple months ago. So symptomatically, first of which being facial and cranial asymmetry. So I've noticed over the past several months to maybe a couple years, I've noticed the asymmetries in my face have become more pronounced, and I've noticed them much more. Now, that's not to say that some of that can't be psychosomatic or psychological in any way, shape, or form. However, objectively comparing and contrasting different images, as you'll see here in a second, I've come to the conclusion that I've sort of come to exacerbate some of these asymmetries in my face for some reason. And I'd like to perhaps dig a little bit into that and get into the bottom of why that might be happening. Particularly better development on the right side of my face. And I notice some difference in the position of the ears. I don't know if that's due to like some sort of cranial torsion or something like that, but I thought it was worth noting. Secondarily, and my second most noticeable symptom at the moment is the TMJ. I have not been formally diagnosed with TMJ by any dentist or a TMJ specialist, excuse me, but I have all the categorical symptoms ringing in my ears, and they also feel extremely, extremely clogged, like all the time. It's absolutely insane. Tightness in the jaw, in the joints here, that radiate into the temples, extreme masseter hypertrophy, which I received Botox treatment for last month with 8 units per side. And I've got some photos here in a sec. You'll see how big my masseters were. Thirdly, despite my extremely lean body composition, I stay generally sub 10% body fat year round. I have an extremely fast metabolism, and I exercise pretty aggressively 6 days a week. So I have this double chin, right? This pseudo double chin, which I'm not sure is perhaps a consequence of a low hide bone position, or perhaps a deleterious downstream effect of poor neck posture from childhood. I'm not really sure. I couldn't tell you, but I'd love to figure out why, perhaps. So I've got that highlighted there to come back to later. Fourthly, sort of plays into the double chin here. A lot of face fat, a lot of face fat. I don't have anybody in my family with a chubby face. I mean, my mom's got a bit of a baby face, and she's got very pronounced cheeks and cheekbones. The face fat thing has been extremely confusing to me since I was a kid. I was sort of waiting to turn, 22, 23 like I am now, and hopefully get a bit of a leaner face. And that has happened a bit, but at the same time, I'm confused why I hold so much fat in my face, other than, of course, the obvious genetic predisposition or something to that effect. And again, no family members with extremely chubby faces or anything like that. And we're all very lean and so on and so forth. I have heard, if it's worth mentioning, that some people, when they improve their neck posture and perhaps adjust their sleep position, experience a leaning out of the face and cheeks, or, the classic Mew swallowing techniques or something that don't utilize the buccinator muscles in the cheeks or something like that. Not really sure. We can touch a little bit on that in a bit if you want. Fifth, I have relatively poor sleep quality at the moment. Lethargy, chronic fatigue, brain fog, all the classic symptoms of not getting proper REM sleep. And so that's why I got the septoplasty and the serpinoplasty, because when I went to an ENT, he noticed that I did have some clear structural obstruction on the left side of my nose. So he went in there and took care of that. And that seems to have improved my issue by 40% or so, give or take.
Well, that's pretty good.
Yeah, it's not bad. I've enjoyed the benefits so far, but I have noticed some regression since I got the procedure. Obviously, the first few weeks of that recovery are pretty rough, and you can't breathe through your nose whatsoever, right? But then it got really, really good. I was experiencing almost not quite an empty nose syndrome. It almost felt like it for a bit, and it regressed a bit. Now I'm starting to notice some disparity between the two nostrils, but I'm sure that's slightly normal. I don't think you can get a perfect Endgame with this procedure. So, and then a couple things to finish off here with the symptoms. My tongue feels really crammed between my molars when I try to mew. And granted, you'll see in a moment that I don't know if I'm mewing properly or not, but I like to think that I am, especially given that I've watched your content and Dr. Mew's content on the suction hold and things like that. I've tried my best to perfect that as much as possible. But even so, My tongue still feels very, very, very crammed between my molars, even with this 44 millimeters of intermolar space, which, correct me if I'm wrong, is pretty decent amount of
It's
space.
definitely above average. Yeah, way above average. I mean, I was talking to someone earlier who was at like 24.
Yeah, I watched a podcast with an Asian kid my age as well. He had about, what, 23, 24 millimeters
Yeah.
of space, and
Yeah.
that was, you were talking about if he could even get an MSC fit up into there in the
Correct.
first place,
Correct.
which was really interesting.
Mm-hmm.
And then just to summarize the symptoms here, just an overall degradation in my facial appearance in the recent years. Granted, you have to take that with a grain of salt because I am so hyper focused on my appearance and so on and so forth. However, again, like comparing and contrasting different images and noticing certain things over others, I feel as though perhaps there are some symptoms that may be contributing to inflammation or different things that perhaps exacerbate asymmetries, something to that regard. Um, so just some speculative points here. My initial dystrophy in childhood and early adolescence seems to have been obviously attributable to my poor posture and mouth breathing, of course. And so I took those corrective measures I mentioned earlier, in addition to things like chin tucks and mouth tape. But the dystrophy was always present. I always had a lack of facial development, which has improved tenfold since then. But there are still things that to be improved upon, of course, which is why I'm here. And of course, like I mentioned earlier, the asymmetry itself was not really noticeable prior to puberty. I noticed it around 15, 17, something to that effect. Like I said a minute ago, I was mewing for about a year now, with a high level of commitment, but a poor level of consistency in the posture of my tongue and technique overall. So we can talk a little bit about that later, but that's one of the points I wanted to touch on. And one thing I've been ruminating on is that perhaps the incorrect hard mewing that I was doing earlier, along with possible stress in my personal life, has birthed some sort of craniofacial torsion or tension, causing asymmetry or exacerbating it. And the TMJ also seems to be attributable to improper mewing and personal stress, of course, because you clench your muscles with stress and you hold stress in your face and head and so on and so forth. Also, a very notable and important point that I need to make is that being a bodybuilder for as long as I was, I don't anymore at the moment, or at least taking a break from it. I did use exogenous male hormone and anabolic steroids for a period of 2 years before coming off to address these issues and also just to clean my system out because, well, shit's not good for you, right? So not only accounting for some level of the masseteric hypertrophy, but perhaps some extracurricular quote unquote facial tissue as well, but wouldn't quite explain the asymmetry. So those are just some theories and speculation I have. Here's a couple of photos for you. This was taken on May 18th. And I think here, I don't know why this other photo that I mirrored came out blurry on the PDF, but hopefully you can still see a bit of the asymmetry there. And also the masseteric hypertrophy and the swelling in my face from the TMJ is quite obvious. It should be noted that my face is not 100% facing the camera properly. And interestingly enough, excuse me, that's been a consequence of noticing asymmetry in photos that were taken straight on from another person with a camera or something. And I tend to overcorrect to one side or another. So I've developed this habit of not facing the camera 100% because I'm either overcorrecting to this side or to this side because I can't figure out how to make myself look symmetrical on camera. Very weird psychological phenomenon, but notable nonetheless, I suppose. So the photos
show
here,
what
I'm sorry, go ahead.
Yeah, are you gonna showcase the asymmetry and point out where exactly you see it?
Yep.
It's hard in that photo for me to see just because of the difference in angulation.
Right. So here, these photos are, or were taken at the request of Dr. Mew's team for my consultation I had with him on Friday. They wanted profiles of both sides, 45s of both sides. And
upcoming consultation or prior consultation?
Yes, upcoming on Friday, this Friday.
Okay.
So yeah, I took these photos in preparation for that and sent them over to him, along with the dental imagery that he requested. So Now, the asymmetry is most obvious here as opposed to the other photo or the other couple of photos there. What I notice is in particular mostly noticeable here in the 45. I don't know exactly how to articulate this. It's not something I generally speak about with other people, but I seem to notice a lot better development here on this right side of my face. And I have that. Um, I don't know how to describe it, but it looks more appealing to the eye. It seems as though my jawline is much stronger. It seems that there's uh, a better contour to the other side of my face on this side as well. And my lips look perfectly healthy on this side and pulled up towards the cheekbones and occipital area. And the other side here seems to be not the opposite exactly, but just much less developed than this side here. It's hard to pinpoint how or why exactly, but hopefully you can see what I'm talking about here with the ends of the lips here being
I
slightly
can.
droopier.
The mandible almost seems shorter on the left side.
Right.
That is
Now,
the left side that we're talking about, the short side, right? Sometimes with
correct,
image mirroring, it's hard to tell.
correct,
Do you
correct.
have the TMJ pain on that side, on the short side? Or is it
I
both sides or what?
Well, it's both sides, and it's hard to say now because I have been treated for it a little bit with the Botox, and so it's much less prominent, my symptoms at least, than previously. But the symptoms, as I recall, seem to be worse on that left side. But again, it varied. Sometimes I would have worse symptoms on the right side, so it's hard to say because it's been so long since I've had the crazy symptoms of it. But right now, I just sort of experienced that general clogged and nasty feeling in the ears. I don't feel like I can hear anybody properly. I went to
Both
the
ears?
Yes, both ears. And I think that that's noticeable here in this front-facing photo. Particularly differences in the shape of this area of the mandible here. This seems to concave a bit more here on the right side and be a bit more, how could I say, like, I don't want to say toned. I don't like that word, but it's a bit more well contoured as opposed to
Sharp.
here. It
Sharp,
looks
yeah.
correct. Yeah, it looks sharper. That's a perfect way to put it. And then here, the masseter looks a bit overdeveloped as well on this left side.
Was it always like that, or is that since was there a time and point in time that began getting like that, or was it always like that your whole life?
No, it's not always been like that. I just noticed that probably 2 or 1.5 years ago, maybe
When
even
did you do
less.
the hard mewing? How many
I
years ago?
started that about 1.5 years ago.
So after you discovered this or before you discovered this?
Before I started hard mewing, before I started to notice
Okay.
these things, and I started hard mewing. I started hard mewing actually during some TMJ type symptoms. There was a event that happened in my personal life that was extremely stressful and deleterious to my mental and physical health. So I was mewing after that happened, and I was already experiencing those TMJ symptoms, I think, from just carrying stress in my
Were you
body.
clenching at night?
I was clenching. I don't clench my teeth. I just clench the muscle here in the jaw. I don't
What do you
have
mean? Why don't you
bruxism.
clench your teeth? Because you're ramming your tongue up into the roof of your mouth instead of clenching the teeth?
It's a good question, and it's something I failed to note here in my document. But I don't clench my teeth because I feel as though I have a very short face and a very stubby face. And I feel like these features that I really like about my face are only present, or at least much more pronounced, when I don't touch my teeth together. So I never walk around with my teeth together, only with the tongue on the roof of the mouth, but my teeth are never touching.
But do you know if they're touching in your sleep?
I don't believe so. It's hard to say, but I have been checked for bruxism, and I don't have any signs of grinding at night or anything. I have been informed about perhaps getting a mouth guard or some sort of whatever they call it, device that goes between your teeth when you sleep.
Why would they recommend that if they don't think you're bruxing?
Just so that there's some level of not force, but there's some contact between the teeth and something. They're not just floating in nothingness. But obviously, ever since I've been mewing, I've been keeping the tongue on the roof of my mouth. So
I mean, when I see an asymmetry like this, the first thing I think of is that the TMJ on the left side is a little bit more recessed, and so you have more condylar rubbing inside the socket on the left side. And so what's happening potentially, and I'm just hypothesizing,
Mhm.
is that the TMJ on the left side is actually resorbing at a faster rate than the TMJ on the right side, which gives the appearance of a shorter mandible on the left side. Like literally the mandible on your left side is actually sinking backward into the joint as the
Mm.
joint degrades under unhealthy force.
Interesting.
It's
Okay.
common. It's actually very common. It's one of the primary ways that TMJ disorders manifest is with the shortening of one side of the mandible.
Mhm.
But it's actually not the mandible itself that's shortening. It's the joint is resorbing and the whole thing is falling back into that pit.
Interesting.
And it's definitely possible that that's what you're experiencing, and it will get worse before it gets better if the root cause here is not addressed, and that's something we're going to have to look a little bit more closely into. But the way that this is diagnosed is with a full-on TMJ workup and an investigation into TMJ degradation on both sides, particularly the left side, which is a very common diagnosis that comes, for example, from Dr. Yousefian's office. That's something like that he is very well known for identifying, diagnosing, and then treating.
Interesting. Okay.
But I'll let you continue. I don't want to
Sure.
totally take us down a tangent before I
Sure.
totally know what you want to talk about.
No, fair enough. And that's just in case I forget, let's definitely come back to that if you can, if you remember.
Sure.
One other thing I wanted to touch on these photos here.
Dope tattoo, by the way. I love that. What does that say?
Thank you. It's Petrunic. It's my last name.
I love those tattoos.
Just in case they find my body in a ditch somewhere, they can identify me.
God forbid.
Well, that's what everybody tells me, right? Like, what do you not have a driver's license or what? You need to put your name on your body.
Well, dude, it's good to be proud of your name. That used to be a big deal back in the day. People would live to honor their name, and I totally support you repping your name. Or what else are you going to rep? Someone else's name?
Right, correct. I completely agree. And I'm Croatian background, so we have a very proud heritage, and we're very proud people. Perhaps too much so sometimes, but you know, that's what made me get the tattoo. I appreciate the compliment. Thank you. So one other thing I wanted to touch on these photos here is, first of all, the obvious lack of sharpness here that you mentioned earlier on the left side. Again, the tattoo is on the right side. That's how you can distinguish between the two. And also the pseudo double chin that I mentioned earlier is pretty visible here. I'm not sure when that started symptomatically. I'm not sure when I noticed it, but I have been noticing it more so recently, and also it's been getting slightly better with the mewing. I will say, don't know why that is, but it has.
Is that double chin existing even with your tongue sucked up onto the roof of your mouth? I'm sure it is.
It's existing when I speak with my tongue sucked up. When I have the suction hold and I'm doing it properly, I don't have that at all. I should step back a minute, actually. It may still be there, but just far less obvious than when I'm relaxing, like here. This actually might be slightly mewing. I know I wasn't hard mewing or suction mewing during these photos, but it's far less pronounced when I am doing a suction hold.
Okay.
Probably barely noticeable.
Can I see the roof of your mouth in the camera?
Sure. I've got a bit of a janky camera set up here, so let me do my best.
It's going to be good enough for sure. Yep, just like that. Stop. Where are you measuring your intramolar width from? From the edge of the tooth, or from the base of where the tooth meets the gum?
The edge of the tooth, so the inside edge of the tooth.
Okay.
I'm assuming that's the correct method. Correct?
Well, if people measure it differently, but it makes a lot more sense that you measured 44 from the tip of the tooth and not from the gum, because your teeth seem to be flared out, and that maxilla does not look to me to be a 44 maxilla. But with the teeth flared, I can see how how you measured 44. But yeah, that looks closer to like a high 30s to me. But because you're measuring from the end of the flared tooth to the end of the flared tooth, you're stealing 4 millimeters there on the measurement.
I see. Okay.
When someone tells me 44 intramolar width, I'm expecting to see a caveman maxilla, which I'm not seeing with you. I mean, it's by no means small, and it's still definitely above average for people that I speak to, but that's not a bona fide 44 intramolar width.
You know, you just put into words the way that I've been feeling, because I certainly don't feel like I have a 44 millimeter amount of intermolar space. That's for sure.
Yeah.
Even though I was surprised to see that measurement is basically what I'm trying to say.
Yeah.
And I measured it twice, 3 times. I don't know if I measured it a fourth, but I certainly double, triple checked. And
yeah, you're supposed to measure from the gum
Mhm.
to the gum,
Right.
because there's no cheating there. That eliminates the variable of the angulation of the teeth.
Right. And of course, worth noting that the Apple method, I suppose, is a bit amateur.
Well,
but
it can't pick up on the tooth angulation, or on, it doesn't tell you where the gums are. So yeah, you're
Right.
right. It's flawed.
Right. So yeah, anyway, the hyoid here was just what I wanted to point out, and the lack of sharpness there on the left side. Again, this has sort of been the case for as long as I can remember, perhaps 15, 16, 17, but it seems to have, again, exacerbated with those symptoms of TMJ and so on and so forth. And then just to conclude here, so as far as objectives go, my primary would be to improve my asymmetry. Now, again, these fluctuate from time to time, and I suppose they're probably not in hierarchical order, but I would like to improve my asymmetry, as it has had a deleterious effect on my confidence and taking photos. I seem to avoid taking straight on photos when somebody else is holding the camera, like with the front facing camera. I avoid them like the plague now, when I didn't previously, at least in the past couple of years, but when I was a kid, I did, because I didn't have very much confidence. But I seem to have been stripped away a bit with the exacerbation of the asymmetry. And even if I cannot improve it, which I speculate that I can, at least to some degree, even if I can, I'd like to diagnose the problem, just so, perhaps I can help other people, or I don't know. I'd just like to know. Secondarily, I would like to pursue some ways to lose facial fat in my face, because I do feel like that if I was able to lean my face out, it would perhaps restore some of that confidence that I lost with the asymmetry exacerbation. However, being a bodybuilder, I'm aware that targeted spot liporeduction is just not feasible, or it's sort of a myth, right? Everyone wants to know how to get six pack abs and lose stomach fat, but you can't just do that by doing crunches, right? But I'm open to any and all suggestions, some of which I've already implemented, as I mentioned earlier, like the neck posture, the mouth tape, things of that nature. This would include improving the pseudo double chin, hopefully. Third, and again, not really hierarchical, but alleviating those TMJ symptoms. And I'm sure all of these accumulate into one perhaps protocol, or one mess or conglomerate of different solutions. But the TMJ symptoms are absolutely insane. Like, there was a period where I was having so much ringing in my ears that, I mean, I don't want to say I was contemplating the S word, but like it seriously came to the point of panic attacks, anxiety attacks, and where I just did not want to be alive or conscious anymore. Like, really, really horrible. And it would cause like some disassociation and different psychological phenomenons that I was not having a good time with. And again, those seem to have improved with the implementation and deployment of the Botox, but I know that's just a Band-Aid on the problem that needs to, be actually fixed. So just to summarize, my sleep and nasal breathing have improved quite a bit over time. So I blush to complain about the sleep quality, even though I do still wake up very tired and I lack energy. I actually can breathe out of that left nostril, as I mentioned earlier, at this point, as opposed to some years ago, I couldn't breathe out of my nose, period, when I slept. And I think some of that is just due to taping my mouth and allowing my nose to become accustomed to airflow. But it's worth mentioning that I realize the extreme nuance and particularity of the subject of craniofacial dystrophy and orthotropics in general. Therefore, I am trepidatious about trying to pursue treatment for these symptoms, which overall could be very largely psychosomatic, as I have been hypochondriac, I have been body dysmorphic, and I have had different, psychological manifestations of that nature. Just being somebody who's a bodybuilder and very particular about their appearance, those things have occurred before. So I'm wary of those things, or trepidatious about them. But with that being said, I'd like to do as much as I can to improve, and hopefully relieve some of these symptoms that I mentioned. So that's what I got for you, man.
Do you have any photos of your bite?
Oh man, that's a great question. I think I do, actually. I sent some photos, as a matter of fact, to Dr. Mew.
Yeah, I need to see what your bite looks like. Maybe you can just show me on the camera.
Suppose I could.
Can you end the screen share and so that you become more prominent on my screen?
Absolutely. How's that?
Yeah, that's good.
Okay.
Yeah, just look dead on and just show me what your bite looks like.
Okay, so
just like this.
So this is molars together.
Show me your side profile in that bite. You have a deep bite too. And bite down like that with your molars together, as you said, and then keep your lips sealed, and then show me your side profile. And now show me, do you have some other bite that you like to use? What, like a lower jaw forward bite?
Lower jaw forward and hanging, molars not touching.
Show me that.
This is how that looks.
Smile. What were we looking at in the photos?
In the photos, this is this bite right here. This is just relaxed, molars not touching, nothing like that.
Okay. Well, then your problem, man, is that your lower jaw is jammed back into your TMJs. Your maxilla, the angle of your maxilla is fucked up and it's recessed. Your maxilla is too far back and it's downswung, especially at the front, which is why you have that deep bite, why your lower jaw is crammed back. And that's probably what's causing all of your TMJ symptoms and the looseness of your skin under your chin. It's basically just there's not enough bone support for the amount of skin that you have. Possibly also in your facial fat is just that your skin is just not pulled taut enough underneath the bone structure. So, and you can also see it in your nose. Your nose is slightly curved. It's slightly hooked, which is further evidence that your maxilla is too far back, because of course, when the maxilla is too far back, the soft part of your nose goes with it. It gets pulled back by the maxilla. So give me a side profile.
Sure.
Pull your glasses off, please, for me, Robby. Okay, now do this for me. Here, watch what I'm doing. So go like this. Go. And puff air into your upper lip under your nose.
Gotcha.
The side profile. Stop that. Let it go. Yeah, one more time. Okay, see, that straightens your nose right out. So,
oh, interesting. Okay.
Yeah, so you'll see that on video later. So, I mean, dude, so maybe you're body dysmorphic and maybe, you're hyper focused on the way you look, but your TMJ is not in your head. Your symptoms are not in your head. And absolutely. So I think that's real. I think big picture, 20,000 foot perspective, you're better looking than 99% of the guys I talk to. You're definitely capable of slaying.
I appreciate that. Thanks, man.
I don't think any rational person is going to look at you and say, "Oh, this kid has craniofacial dystrophy." What it's over for him. No one is going to say that. Okay, you're a stud. Just thanks, at a glance. But you have objective shortcomings in your facial structure. And I think that's what's happening with you. I think the root cause of this is your maxilla. And unfortunately, there's no good way to fix that apart from jaw surgery. Because what you really need to do is take your maxilla, pull it forward, counterclockwise, rotate it. That's what you need. And in the meantime, until you do that, the left side of your jaw is going to continue to shorten as the TMJ resorbs. And as there's destruction in that joint from that, particularly that left side being particularly jammed back and bone on bone sort of rubbing and resorption, and that's just going to spiral, and the TMJ symptoms are going to get worse. That side is going to get shorter and shorter, and you're going to get more and more retrognathic as that continues to occur.
So in other words, it's something that needs to be intervened with and addressed at some point.
I'm not saying anything needs to happen, but if you want X result, then Y procedure needs to be done for it. I mean, you could do nothing. Plenty of people live with the problem that you have, but I would say those people probably don't know what's really happening and just are too ignorant to do anything about it. But obviously, you being deep into this space know what your options are. I'm sure you've heard of Lefort, cuts and Bimax and whatnot.
I'm not going to lie. Despite perhaps as it may appear that let me rephrase. It may appear that I know more than I do about options. I've researched a lot of symptoms and possible causes and diagnostics, but not much into the treatment or options as far as going forward. There's really not much I could tell you that I'm aware of as far as just double jaw surgery and MSE. Those are the only things I'm familiar with.
Yeah, I don't love MSE for you because I just don't see how that's going to address any of your immediate concerns. I think
Okay.
for anyone who is very particular about the way they look, the MSE is definitely hit or miss when it comes to aesthetics. What would MSE do for you? Maybe a small MSE expansion, 4 to 6 millimeters. That would at least allow you to tip your molars in and still have a bite. It might help hollow out your cheeks just because it's going to pull these bones a little outward and it's going to create a little bit more of a concave profile to your cheeks. Smile for me. Dead on. You don't really have buccal corridors to speak of, but show me again. Show me your smile again. I want to see the angulation of your teeth. Come closer. Maybe they're not tipped out. Roof of the mouth? I don't know. You could definitely tolerate a small MSE expansion.
Okay.
I guess another option for you would be MSE and a face mask. That could potentially help too. But that's going to require. Yeah, go ahead.
Apologize for that. I'm not familiar with what exactly face mask is doing and what the effects of that are. It's one thing I've heard a lot of conversation about and a lot of dialogue about between guys on your channel and different areas as well, but I'm not very familiar with it. Could you just give a brief summary as what face mask is?
Yeah, so face mask is what is a name for reverse pull headgear. So basically, it's a way of applying a pulling force on your upper jaw and all the bones attached to it upstream forward. So you use an MSE or a MARPE to loosen the sutures. It's like microwaving butter for a couple of seconds, just loosens it up just a little bit with the MARPE, and then you pull on it for, let's say, a year with a face mask for 14 hours a day. Essentially, you attach the face mask is essentially a brace that comes out here, and then you attach elastic bands from the brace to your MSE, which is bone anchored, and then it pulls the whole upper jaw, upper part of your face structure forward, which for you, who, in my opinion, your biggest issue is not narrowness or asymmetry per se, at least in the maxilla, but it's just being too far back and trapping your lower jaw, can pull your upper jaw forward, which can allow your lower jaw to swing forward and relieve your TMJs.
So in my case, do you think that would be a more efficacious option than something like a jaw surgery?
No, it could be an adequate option that would take a lot longer and allow you to avoid surgery. But if you're willing to do surgery, then the surgery is going to be faster and a lot more substantial in what it can actually do in terms of advancement and rotation.
Now, I have to ask, because this is one concern that I do have with surgery when you mentioned it. Number one, could there be, well, I suppose there always could be anything, but is it likely for any deleterious aesthetic side effects to occur? Like, will it change the way that I look drastically, so much so that I don't like my appearance anymore, or so much so that I'm not adjusted to it, or something to that effect? And are there other downstream ramifications, negative ramifications of this procedure that you're speaking of?
So yes and yes, it's possible. It's so let's take so first of all, if someone fucks it up, yeah, you could be upset if they leave you canted or if they pull you too far forward and now you look like um, a crocodile.
Hmm.
Um, that would definitely be. It would be great for your airway. It would be bad for how you feel about the way you look.
Hmm.
A good surgeon won't do that.
Okay.
I think if you were to do MMA surgery, it would be a very modest advancement.
Okay.
So let's say an aggressive advancement is 1 centimeter of advancement on the maxilla. Maybe you need 5 millimeters. Maybe you need half of an aggressive expansion.
Hmm.
Okay, which is a lot to go through for a half a centimeter. But if that's what you need, that's what you need, right? Like you don't
Hmm.
want to go any more just because, like, yeah, you want to get while the getting's good, but that doesn't mean you want to overexpand.
Hmm.
So I think as long as it's done carefully and conservatively with a good surgeon who has a fine aesthetic taste, I think you'll be okay. Um, but there's always a chance of a botch. The percentage of botched procedures is very high. You mitigate that by working with a better surgeon.
Hmm.
In terms of um, general negative consequences of surgery, the recovery sucks. It's expensive,
Hmm.
and you're probably not going to get it covered by insurance unless you can demonstrate, an actual TMJ disorder, which is definitely possible. I mean,
Hmm.
it appears that you have a legitimate TMJ disorder, especially on that left side.
I would concur. Yeah.
Um, so with Paxos Appeals, for example, who I have a partnership with, if you had a TMJ diagnosis, they could probably get your surgery covered by insurance,
Interesting.
since it is the best way to treat a case like yours, from what I've seen. Otherwise, you're just doing massive amounts of camouflage orthodontics, really
Hmm.
fucking going crazy, intruding and extruding teeth and a billion and one things to try to fix that deep bite. And
Well,
that
I would assume the insurance companies are going to do their best to probably get those options on the table before any sort of, multi $10,000 surgery.
They might want you to try a splint or something first.
Hmm.
But I don't think the insurance company is going to force like orthodontic treatment on a
Okay.
TMJ disorder, because I think even for them, the potential of orthodontics to correct TMJ disorders is probably tenuous, but they'll probably put you into like some sort of splint first.
Hmm.
So it would be a process. Paxos would be the best people to talk to about that process. Um,
Okay.
but
If you wouldn't mind, before we hang up, if you could send me any information you've got on them, or any of the things you're referring to, I'd appreciate it.
I will. I just did a JawCast with them. I think it's called "Is Jaw Surgery Covered by Insurance?" Um, and so, but I will send you a follow up all about that.
Okay.
They're great. They have a 94% success rate. Helping people get covered for insurance.
Hmm.
So, otherwise, the big side effects of surgery, besides recovery, potential for being botched, and cost, are numbness in the lips, which gets better with time unless they really make a mistake and cut something they're not supposed to cut.
Hmm.
But generally, it's a pretty predictable procedure.
Okay. Interesting.
Yeah.
When I think of maxillary jaw surgery, I'm thinking some crazy um, amount of risk involved, and perhaps not as high of a success rate as you mentioned. But that's an interesting stat. 94% is pretty confidence inspiring.
94% is Paxos'
Oh,
success
excuse
rate in
me.
getting insurance covered,
Got it.
getting insurance to cover jaw surgery. The overall success rate of jaw surgery, you wouldn't want to look at it like that. You would want to look at an individual surgeon's success rate,
Okay.
because at the end of the day, you're going to work with one surgeon, and all you care about is what kind of results they get.
Hmm.
So for a
Fair
guy
enough.
like you that's hyper focused on the details of their body, you're the kind of guy who you really need to like save up, do the research, find your guy or woman, although I can't say that I know any female orthodontic surgeons, so I guess your guy. Pick the right surgeon, do it once, right the first time.
Fair enough. Well, I live in Cleveland, and obviously we have access to the Cleveland Clinic campus here, so hopefully that there's, you know, somebody of high regard over here. But if not, you know, I'll have to expand my reach a little bit more.
Yeah, no, a guy like you, I don't know if you just want to go with some run-of-the-mill surgeon that you find at a good hospital, and maybe you do have a great orthodontic surgeon at the Cleveland Clinic, but I feel like someone like you wants like a Gunson or a Wallin, someone who's really known for creating good aesthetic results.
Okay, so these people you're familiar with their work in this field?
Yeah, there's definitely good surgeons that I know who like the ones that I would consider using.
Okay.
You know, maybe Dr. Alfie. There's 5 or 10 of them.
Okay. Interesting. Honestly, I have to say, out of everything that I expected from the phone call this far or the conversation this far, surgery was not one of them at all. I thought perhaps the fact that I was even ruminating on maybe I need, maybe my maxilla is recessed and maybe I do need maxillary advancement surgery. I honestly, I thought I was crazy. I thought I'm thinking, wow, I'm way too obsessed with my appearance and I'm way too hyper focused on different symptoms and so on and so forth. But I have to say, I'm slightly relieved to hear you say that because I don't feel so crazy anymore that perhaps a procedure of that nature could help relieve some of the symptoms that I'm experiencing.
Yeah, there would be other ways to camouflage it. You know, there's this build-up approach to solving TMJ issues like yours, where they essentially just crown a bunch of molars to create a new bite. But that's a cope, and it's also not cheap, and it's also not minimally invasive. Sure, you avoid cutting the bone, but you're essentially issuing a death sentence to half of your teeth to make that happen.
Sure.
A really skilled orthodontist might be able to finagle your teeth into a better bite, but certainly the most elegant approach that's really going for the jugular of your issue would just be to take your maxilla and re-angle it and pull it forward a bit to solve your, you know, your lower jaw being trapped back issue.
Yeah, to be frank, as I'm sure you would agree, I'm not really interested in camouflaging. I'd like to just knock it out as much as I can with one blow, which is, to be fair, what I thought I was doing with the septoplasty and turbinoplasty. I thought I was doing that in some regard, not necessarily in the area of craniofacial dystrophy, but just with the symptoms that I experienced, like brain fog and fatigue and so on and so forth. I thought I was doing that, but that doesn't seem to have really contributed more than 30-40% in that category. Again, don't want to seem like I'm complaining there because that's a very drastic increase, but at the same time, I still experience these symptoms exponentially more noticeable than, you know, when I was a child, for example.
Yeah.
So,
well, look, you know, your nasal surgery addressed one part of your airway, and it's an important part of your airway, which is your nasal breathing. Okay, but with someone like you who has a trapped back lower jaw, you still have the elephant in the room, which is your pharyngeal airway, which is your throat, and that's the most common part of the airway that collapses during sleep that causes people to have sleep disordered breathing. You know, you lie in the supine position, which is to say on your back, and, you know, you get this, you know, and that's what causes you to wake up with your brain fog. And then probably what's happening, I suspect, with you is that because you're young and your body is fit, what your body is doing to fight this is it's clenching forward. Okay, it's you're going into this fight or flight state where you're clenching your lower jaw forward, which is, given your poor bite, is exacerbating the TMJ sort of orientation, especially on the left side, causing that TMJ to resorb and get shorter, which is manifesting in your shorter mandible on the left side, also causing this horrendous tension that you're experiencing when you wake up in the morning, also causing, you know, your brain fog and other symptoms of poor sleep. And it's honestly, man, your case is pretty common.
Interesting. Okay.
Yeah, it's pretty common. It's just not everyone is as intelligent and mindful as you are, self-aware. You call it, you've mentioned body dysmorphia, hypochondria, but
Hmm.
some would just say that you're sensitive and aware. And it's a double-edged sword to be that aware. It can lead you to insanity, but it can also lead you to genius. And I think there's always been a tension historically between genius and insanity, and maybe you're walking that fine line.
I absolutely am, and I'm honestly, I blush to say that I'm slightly choked up to hear you say that, because I really have been walking this fine line of insanity versus perhaps some stroke of genius or brilliant light bulb idea. Because when I spent the money to get this consultation, and I spent the money for the Dr. Mew consultation, I actually felt like, I'm like, wow, I'm descending into a pit of hell that I'm never going to come out of, because I'm just going clinically insane trying to figure out what's wrong with me when there's probably nothing wrong with me, and I'm probably just a schizomaniac. But to have somebody else agree with me, not in some attempt to just sympathize for the sake of sympathizing, but in actual agreements with the data that I present itself, and what you can see objectively just from looking at me. The amount of relief is just like, you have no idea. You have no idea.
Well, I appreciate that, man. And this is what I do. I talk to a lot of people in situations analogous to yours. And just to go toward what next steps are for you, I think that obviously I'm just diagnosing you through a screen. I'm not diagnosing you. I don't diagnose. I'm not a doctor or a
Mm-hmm.
dentist or any kind of health professional. But I'm connecting dots theoretically,
Mm-hmm.
conversationally, just by looking at your skin and photos. But what you really need is a proper diagnosis from a TMJ competent dentist or doctor.
Mm-hmm.
Dr. Yousefian comes to mind, since I've seen his treatment plans coming from people I've spoken to, and he does fantastic write-ups on TMJ disorders like yours. You're going to need that anyway if you plan on getting your jaw surgery covered by
Mm-hmm.
insurance. So maybe what you do next is you go see someone like Dr. Yousefian, who, you're in Ohio, you're already halfway there. He's in Seattle, Washington.
Mm-hmm.
Actually, he's in Bellevue, Washington, just south of Seattle. Maybe you go see him, have him scan you up, have him give you a workup, have him try you in his Apnomed appliance for a little while to just see if that really is what's causing your pain. Because what that appliance is it is a splint. Okay. And I don't recommend a splint as a cure for you.
Mm-hmm.
Okay. I don't ever advocate a piece of plastic being worn in your mouth as a permanent solution to a situation like yours, especially as how old are you again?
23.
Jesus, man. You're so young and so brilliant for your age.
Thanks, dude.
You're not going to wear a piece of plastic in your mouth for the rest of your life. Okay. You have a lot of life to live.
Mm-hmm.
And so, but the splint from Dr. Yousefian, which he calls the Apnodent
Mm-hmm.
or the Apno TX, they're very similar, is a diagnostic tool. You wear it. It puts your mandible into a healthier position forward where you're already resting it by your own intuition.
Mm-hmm.
Okay. Puts it there in a more, let's say, stable configuration throughout the day that doesn't require you to have to like mindfully advance it.
Mm-hmm.
You just do that for a couple months and see what your symptoms are like, right? Don't do any more Botox in the meantime, because the
Okay.
Botox is muddying the waters.
Right.
It's essentially a painkiller that's hiding your real
Sure.
pain.
Sure.
I just felt
like I was at the point where I'm like, I need to do something to relieve some of these symptoms somehow. And that was an option that I had, which was cheap, by the way.
For sure. And look, the Botox too was a diagnostic tool.
Mm-hmm.
You took those muscles offline and you felt better.
Mm-hmm.
So the problem is that those muscles are being overactivated.
Mm-hmm.
Now we're going to go one layer deeper, which is what effect is the bite, the occlusion, the malocclusion in your case, having on that muscle, the musculature tensing up in the first place, right? So we're
Mm-hmm.
going one layer deeper. And then the final layer is if we can demonstrate over, let's say, a 6-month period with the splint, that by putting the mandible into a better orientation, that the symptoms subside. Now we go to the final layer, which is permanently giving you that structure by moving your jaw bones. And that's the order of operations.
So one question that I have in regards to that is, have I not been doing something similar to that manually by pressing or moving my jaw forward as I walk around and about my daily activities? Or is this moving it into a different position than I've already been doing manually?
No, you are mimicking what the splint is going to do. But here's
Okay.
what the splint, but every time you eat, for example, right?
Mhm.
You have to eat in a way that your molars touch.
Right.
Otherwise you can't chew.
Mhm.
And then the other thing is when you sleep, you can't be skillful about your mandibular placement. So you're probably just clenching back into that molar contact bite,
Yes. Yes.
right? So sleep is the 30% of your day that you have no control.
Mhm.
And then lastly, you need to make it official, probably for insurance purposes.
Right.
So those are the advantages that the splint gives you that your reposturing don't give you.
Understood. Now, something came to mind, and that is that one of the issues I have with when I do manually move the jaw or protrude the mandible forward and I try to bite is that my two front teeth are so long and large that I just am not able to get a seal on the front teeth, so much so that it prevents the molars from getting a seal as well. Is that going to present an issue with treatment down the line if I choose to do so?
I mean, what you're describing is why an orthodontic solution to your problem is difficult. Your teeth, because your maxilla is grown unnaturally in this sort of downward swing,
Hmm.
right? Especially the front of your maxilla, which the root cause of that is probably poor tongue posture as an infant.
Hmm.
It's really hard to move those teeth in a way that they get out of your lower jaw's way without either shaving them down, intruding them, or doing a million and one other camouflage orthodontic tricks to kind of get your front teeth out of the way of your lower jaw to swing forward. And you can do that. And I said that earlier, that you can camouflage the fuck out of this with
Right.
orthodontics. You can,
Hmm.
another thing you can do is you can do buildups on your teeth to just make your back teeth taller so that your front teeth are relatively not as much in the way.
Hmm.
But the root solution is to just take your maxilla and rotate it. Okay?
Hmm.
Because it's the bone that's angled and the teeth are just furniture on that floor of that angled floor.
Now, given that it seems obvious at this point, I have a downswing in the maxilla. Um, is it also obvious to you that I have a cant laterally, causing asymmetry?
So just so you know, Robby, I have another call I got to jump on. It started at 5. I'm already a minute late.
Oh, I
So
apologize.
no, you're good. So we have to wrap up probably after this, after
Sure.
looking at the cant. But show me what you think to be a cant. I haven't seen a maxillary cant yet, but let me take a look.
Well,
Smile right into the camera. Maybe a slight cant with your right side being higher than the left. Is
that,
that what you see?
yeah, that was
Yeah,
my synopsis. Basically, that
yeah,
was my conclusion.
yeah. It's
I
there. I
I
see
have
it.
I have no particular objective asking you that. That was out of curiosity.
Well, it's there, and just another important point to make about the cant is if you do a marpy, the marpy will probably make that worse. Which for someone who is hyper aware of their facial aesthetic is going to be very disconcerting for you. You
Okay.
take that to an extreme where if you get, let's say, a 10 millimeter MARPI expansion, MARPI being the same thing as MSE, by the way, just
Okay.
a nasomaxillary expander, a big expansion would take that cant and it would make it way worse. Okay.
Okay. Interesting.
Another reason why surgery, um, when they correct your maxilla surgically, they just take the maxilla and they just flatten it,
Hmm.
right?
Hmm.
So another thing to keep in mind.
Fair enough. Okay. Well, I know you've got to go to your next call. I appreciate the time. I really, really do. This has been extremely helpful. Like I can't even put into words and articulate how helpful this has been. To conclude, number one, are you able to send me as much follow-up information as you can in regards to uh, procedural information and perhaps any sort of protocol or next steps to follow? I know that we talked about stuff earlier, but if you can send me anything, I would appreciate it.
So the best thing for us to do is I will just give you that right now orally
Okay.
while it's fresh.
Okay.
And also just because I'm terrible with email. So
Sure.
For you, procedurally, I really feel strongly about you going to see Dr. Yousefian to get a diagnosis.
Okay.
I don't take conditions like yours lightly. If in fact your left TMJ is going through a state of resorption right now, I don't know if I trust many other people in the country to look at that and diagnose it. Certainly not anyone in the Midwest. I don't know anyone. Maybe if you come east, you could see, Dr. Lipkin, who's also fantastic with TMJ issues, or Dr. Evans. But given your location, you're going to be traveling to one of the coasts, and I would say Dr. Yousefian is the next step for you. And then if you do engage with Dr. Yousefian, he likes to work with a surgeon. I believe his name is Samuel Bobeck. So he would sort of coordinate that. But you might be surprised. Dr. Yousefian might have some tricks up his sleeve where he could do, like, I don't know, but he has a lot of orthodontic tools available to him where he might be able to provide some orthodontic relief to your situation. I mean, he's going to give you a splint to start as a diagnostic. Apart from going to see Dr. Yousefian, what did you have in mind in terms of like information you wanted me to provide you?
Well, as much information on the surgery that you mentioned as possible, as that's something I don't want to take lightly, and I wouldn't want to step outside the realm of the expertise of people like you that I'm consulting. So I wouldn't want to, essentially, I wouldn't do anything that you wouldn't do yourself.
Sure.
Given our conversation today. So I'd like some more information on that if you can provide it. And then
so on that note, let's just knock that point out. So I don't have a lot of information about surgery. I'm trying to put that together. So here's what I can give you. I can give you names. I can give you names of surgeons that get a lot of positive hype across the internet.
Okay.
So that would be Dr. Michael Gunson in LA. You can do lots of searches on him and his results. That would be Dr. Wallin, and anyone at LA Comms. LA Comms is like an orthodontic surgery group in Los Angeles.
Okay.
You could watch my interview with Dr. Alfie, which is an excellent matrix download on jaw surgery.
Okay.
Dr. Reza Movahed not only does he do surgeries like the ones we talked about that involve a maxillary advancement, but he also does TMJ replacements, which if you don't get a grasp of your situation, you could end up needing a TMJ replacement at some point.
Well, I don't want that.
No, you don't. Dr. Paul Kociancic, who runs the Profilo website, who I just interviewed the other day. I'll be posting that, although we didn't really get too technical on jaw surgery, but anything by Paul or about Paul would be insightful for you. And then another interesting thing would be if we did end up posting this interview, we had mentioned that earlier.
You're more than welcome to if you'd like.
Okay, well, if you do end up allowing me to post it, then you're essentially opening yourself up to comments, which are oftentimes, in my opinion, very helpful because my audience, man, is so smart and so well researched. And if we do post it, then we can just invite people in the comments to also share their thoughts in terms of next steps for you, which could be helpful.
By all means. By all means.
All right. Thank you, man. And what else, Robby? What other information did you want?
Lastly, the only other thing I'm curious about is you mentioned getting a diagnosis with TMJ, and you mentioned Dr. Yousefian, of course. Is it worth my while, or is it at least worth a shot to, if I have a TMJ specialist around here, I can get a quick appointment with and perhaps get a diagnostic, and maybe they do diagnose me with, again, that issue on the left side, as you mentioned earlier. Is that worth doing? So that way I don't go all the way out to Dr. Yousefian before perhaps moving into the next step of the protocol? Or would you recommend just probably forgetting that to begin with and going out there to Seattle?
I mean, I'm at a point in my life where I feel like my time is so limited that if I know that there's a top person out there that can give me an answer, I would just get up and go, especially with TMJ diagnosis. it's a fucking minefield out there, man. I mean, everyone has their own pet theory about how TMJ issues work and evolve and how to treat them. And I don't know anyone in Ohio or anywhere near there that is going to be able to give you that answer. And so you could certainly do research and take a stab at it and take an appointment with an orthodontist, maybe someone who at least mentions TMJ disorders on their website. Could be worth it. But in terms of the fastest route to success, it would just be to make an appointment and travel. You may be able to get a digital consultation with Dr. Yousefian to just feel each other out initially. But yeah, no, my answer to your question is I wouldn't even bother locally. And I wouldn't treat it as just what do they call it?
Just flippantly.
I wouldn't just see the TMJ diagnosis as like a path to jaw surgery. You actually want like someone who understands what's going on, because even if you need, even if you end up doing jaw surgery, you're going to need an orthodontist who's going to prep you for jaw surgery. And you want whoever that person is to understand the goal that you're striving towards in terms of the ultimate bite that you want to achieve. So you're going to need a good orthodontist anyway.
So don't treat it just as a flippant prerequisite for jaw surgery, and actually take it seriously.
Exactly.
Just as seriously as the jaw surgery. Okay.
100%. Your orthodontist is going to be your quarterback throughout the whole process of you seeking surgery, getting the surgeon to take your case, and then you need the surgeon and the orthodontist to coordinate on what the final goal and vision of your face is going to be.
Now, I'm assuming whoever I see surgeon-wise would take care of figuring out who that orthodontist would be, or do I need to figure that out on my end?
Well, it's kind of a chicken and the egg thing. I mean, I think you start with the orthodontist and then you go to the surgeon after. The orthodontist is the quarterback. The surgeon is like a contractor, really, not the other way around. I mean, you're going to see the surgeon twice. You're going to see the orthodontist 25 times.
Interesting. Okay, I'm glad you said so. I just like to be as specific as I can about these things. I don't want to meddle about and muck about. Well, lastly, if there's anything else, any other comments, concerns you have, just let me know.
Don't rush into anything. Take your time with the diagnostic phase. Let Dr. Yousefian do his thing. He's slow and deliberate about his treatment process. There's a long diagnostic phase. Embrace that. You're not in a hurry. You're young enough to just sort of go along for the ride with him.
Okay, that's a relief to hear.
He can be trusted.
Okay.
And then, so that's what I would say. Just start there and go through the motions with Dr. Yousefian.
With that being said, I'm assuming time is still of the essence, and it's better to correct this sooner than later.
Correct, but you can't rush quality, and you can't rush what he's going to be doing, because a big part of it is just getting the splint and then sitting back and watching to see what happens.
Sure. Okay. Well, listen, man, I really appreciate the time. This has been a very productive conversation. The most productive conversation I've had in regards to this subject, because there's just nobody else that I can converse with or have dialogue with about this and get any sort of mutual understanding or benefit from. So I appreciate it very, very much. I can't articulate how much, actually. And congratulations on the wedding, by the way.
Oh, thank you, man. No, I appreciate that. And yeah, it was a good time, and I'm glad to be married. And I'm having a baby in November.
Well, congratulations, man.
Thank you. And I'll just say I enjoyed speaking with you too. I really, one of the greatest pleasures in my life is meeting intelligent people like yourself, who can force me to be on point and who are very fast and in the back and forth. And I think as, intellectual people like ourselves, dare I say intelligent people like ourselves, at the risk of sounding arrogant, it's rare to find other people who can have that banter with you. And so I've enjoyed it tremendously, and just keep doing your thing, man. Okay.
Likewise, man. I really appreciate it. And hopefully, who knows, I'll probably book a follow-up at some point with you, and we can talk about what steps I've taken between now and then.
Okay, bro. I'd really enjoy that.
Awesome, dude. Well, I'll talk to you as soon as I can, man. Take care of yourself.
All right, Robby. Take care, man.
Thanks a lot, man. Bye-bye.